Our top story this noon hour, a deadly drug that has impacted countless Utah families. We're talking about fentanyl.
Yeah, today, Governor Cox, state leaders, law enforcement all coming together to address the fentanyl crisis here and what they're doing about it. New specialist Kara Bracken joins us live with the steps they say they're taking to tackle this huge problem that's not just a Utah problem. It's really across our country. Kara?
Yeah, that's right, Dan Shara. So the next step that Utah is taking right here at home, they are creating a fentanyl task force. They want to see how fentanyl is coming into our communities and into our homes. They want to see how it plays socially, economically, even psychologically.
Fentanyl now affects everyone.
Governor Spencer Cox says no one is exempt from fentanyl's reach as it's in all pockets of the state, from big cities to the smallest towns in Utah. The problem only growing. From 2018's 1,600 fentanyl pills seized by agencies to last year's 2 million pills seized. We got a firsthand look of how much is being gathered through drug seizures back in August with the DEA. That's why this task force, they say, is crucial.
Based on experience, evidence, and example of effective task forces in the past, we will accomplish the task force mission by focusing on 7 key objectives. These objectives are centered on prevention and treatment.
Using and interacting with a variety of drugs, including meth, heroin, and fentanyl, Misty Lopez, now 3.5 years sober, recalls some of her darkest days due to fentanyl.
Many times I picked it up right here along the Jordan River Trail. As my addiction worsened, so did the consequences. I was arrested constantly, 9 cases, over 30 charges, most for distribution, fraud, and paraphernalia.
Now, though, it's full circle as she's helping others on their journey back to health as a success story.
And I'm now currently in school for human services with a concentration in addiction and hoping to get my PhD later in forensic psychology.
Now we're here on the Jordan River Trail again, one of those popular areas that she says played a part in her journey. Now that said, they are, as a state, they're looking into how this task force can make a difference and make it more difficult for those selling the drugs, for it to make its way into the state, and then to make it easier for those in the state who are struggling with using the drug. Guys.
All right, Kara Bracken again. What the governor said is correct. It touches everybody's lives, and so learning more about it can only help us in this state of Utah. Kara Bracken reporting live. Thanks, Kara.